we live?
Are we live? Yes, we are live.
Can you hear me?
Hello.
Can you hear me now?
I can hear you.
Okay.
Welcome back. We've made it 4 weeks in a row. I am very impressed with us. I really am.
That's
Consistency and discipline. These are the practices that we preach. So we are going to try our best to follow them as well.
Usually by now I like Walter, enough. No, I'm actually sticking to it.
Yes. So we want to start with some of the questions that we received over the week.
Yeah, I guess.
Okay.
If you guys send live questions, we'll answer them. But let's go through the ones we have in the past.
So we actually have like 3 questions pertaining to semaglutide. So you want to explain semaglutide a little bit before we get into the questions?
So the first thing I gotta tell you is I tried it. So I know exactly how it feels. I wanted to lose about 10 or 15 pounds. So I tried it. I know exactly how it feels. It really gives you satiety. It really, if you have a fatty meal or if you drink a significant amount of alcohol, you're not happy. I threw up twice while I was taking it because I misbehaved, and the medication punishes you if you misbehave. You do get some reflux, some burpiness, but it really, really takes your appetite away. And it especially takes your appetite away for that picky stuff. And then when you serve yourself a meal and you start eating halfway through the meal, you're like, wow, I'm full. And that's the time to stop. So the weight loss works. One of the questions was, do I recommend it after bariatric surgery? Absolutely. There is almost all the patients, except a few exceptions, have a rebound after their weight loss. It can be in a year, in 2 years, in 3 years, in 5 years. There is a rebound. It can be a mild rebound. Some people go up 10 pounds, which is awesome. Some people go up 20 pounds, which is okay. When you start going up more than 20 pounds, you gotta do something. And I always tell the patients, when you go up 10 pounds, come see me. You gotta do something. One of the somethings we have is the semaglutide, and we are very successfully using. Like everything in life, we have some amazing results. We have patients who've lost 50 pounds. We have the average results, which is around 20, 30. And then we have some folks who lost 4 or 5 pounds, didn't lose anymore. So those are the folks I tell them, this one is just not working for you. We can look at other things. But absolutely, if you haven't reached your goal after bariatric surgery, be it sleeve or gastric, I support semaglutide. If you rebounded and you don't want to keep going up, I support semaglutide. My philosophy with semaglutide, it is an intermittent tool that you're going to use. People go, if I go on this, I have to be this on the rest of my life. No. Will I have to use it over and over? Very likely. Maybe. So my point to folks is, and this is my philosophy, okay? When we get you to the weight loss that we want using semaglutide, we stop it and we watch. Now, if you're lucky, if you're good, if you relearn some good habits, you will stay there 6 months, a year, 2 years, 3 years, then you go back up. We use it again for whatever amount of period we need to get you back. So if you do it right, you stay in a range of about 5 or 10 pounds, 15 pounds. You don't do it, lose 50 pounds, don't do it again till you regain 50 pounds, and then use it again to lose 50 pounds. You use it intermittently to stay in that range. The more well-behaved you are, the more exercise you do, the less intermittently we're going to use. In other words, we might go a year or 2 or 3 before having to use it again. That's combined with other tools, calorie counting, healthy eating, exercise.
So part of our semaglutide program includes a visit with a nutritionist. So that is part of the program that we have because, again, semaglutide, surgery are one tool. Then you need your arsenal of tools. You need the nutritionist. You need the exercise component. You need the supplements. We also recommend supplements when you're on semaglutide. For the patients, so I know we spoke about, so if you had bariatric surgery, you can use semaglutide.
Absolutely.
And it is recommended.
Absolutely.
Now, if you have not had bariatric surgery, who do you recommend is a good semaglutide patient?
So again, what we call the literature, the published studies are still being looked at, developed. As you all know, this was a diabetic medication which happened to lose a lot of weight. We knew people were going to lose weight because we know that's one of the hunger hormones, and this medication decreases, so your hunger was going to go away. It helps with sugar regulation, with insulin regulation also. So we knew it was pretty predictable it's gonna be a very good weight loss approach. We have now gone from using it strictly for diabetics to using it for weight loss, especially when your weight loss, your BMI is in the low 30s. So there's a range of folks who are not really ready for bariatric surgery. In other words, their BMI is not 35, 38, 39, 40, but are not being successful with medical weight loss management without medication. Your BMI is 32, you're a little hypertensive, you gotta lose 30, 40 pounds. It's an amazing medication. You gotta lose 150 pounds, is it gonna work? Unlikely. Like every hormone, every anti-hormone, eventually it peters out. We call it down regulation. The receptors for the medication decrease over time. The effectiveness of the drug decreases over time. So if you have to use it long enough to lose 150 pounds, it's likely not going to be to keep working. It's gonna peter out. But if you're gonna use it for 20, 30, 40 pounds, it works well.
And let's say 30 pounds. How long does the average patient take to lose 30 pounds?
So, multiple variables. Are you exercising? Did you change your diet to a low caloric, high protein, low carb diet? All sorts of issues. Typically, you're gonna lose 30 pounds in about 3 to 6 months. If you wanna lose 50 pounds, which is really at the top end where the drug is really effective, you're gonna need about 6 months to a year of it. So, if you're gonna lose 20 pounds, you could do it a 3-month program with discipline. 40, 50 pounds, probably not gonna do it in 3 months, probably might do it in 6, might take you a year of using the medication.
And just so they quickly understand, we do change the dose that the patients are on.
Yes, because again, there's down regulation. So the same dose gives you less hunger suppression as we keep using it. So we start with a very low dose to decrease the side effects, the nausea, the reflux, the vomiting, the GI distress. If you slowly go up on the medication and then keep going up to a certain limit, then you get progressively effective. But once you get to the top limit, if it kind of peters out and stops working, it's kind of not going to work much more than that.
So, quick intermission on semaglutide. Patient 1 year after bypass, 200 pounds down. Way to go, Alex.
All right, 200 pounds in a year, that is like amazing, I operate in a range of folks. Some folks are 400, 500 pounds. They got to lose a lot of weight. And then some folks got to lose 50, 60 pounds, and they're just going to be so much healthier when they do it. So I see an entire range. Obviously, the ones you go, wow, are the folks who lose 200 pounds.
Great job. So, now back to semaglutide. Okay, do you take insurance for semaglutide?
We don't. It's very difficult to get insurance companies to pay semaglutide. And I'll be frank with you, it's not worth the paperwork, the clerical amount of time I would have to have a receptionist, a secretary, a medical assistant on the insurance company, filling out the form, sending out the paperwork. It's just, it is not worth it. So I tell folks, look, our semaglutide is off-label. It is made for us by a special pharmacies. So it's not the brand names that you're gonna hear. But if you want to get through insurance, go to your primary care physician. They're used to doing all that paperwork, all their insurance forms. The insurance may or may not cover. Many of them are not covered.
Yeah, they have very strict guidelines. For those few that do, it's with a very strict guidelines and regimen that they do cover.
In our practice, it's just, honestly, it's not worth our time to try to get one patient to have an insurance coverage.
Okay, what is the procedure to see you, to see if I can get semaglutide shots? So you just have to call the office and make an appointment, and they'll give you an appointment to come in, and they'll go ahead and take some information over the phone just to kind of make sure that you are in the range to qualify for the program preliminarily. And then you will come in and have an evaluation, and during that evaluation, again, they're going to make sure that you are in the criteria for the program, and that same day you can start the shots if you want to.
You weigh 120 pounds and you want to wear a bikini and you want to do semaglutide? Yeah, not really. That's not what it's for. So we're going to tell you your BMI is too low for semaglutide. You're too healthy for semaglutide. Teenagers, kids, adolescents, it's not really being shown. It's not really approved. So some practices are doing it. We're not. So if you're under 18, we don't do it.
Wait, why isn't it allowed to work the core for up to 1 year post-op? So questions were a little different. So we tell our patients no core
crunches or abs.
Right.
So core includes more than just abs and crunches, because theoretically, if you're doing a squat,
Or Pilates,
if you're doing
or-
Pilates, if you're doing you're still working the core. So it's not really no core. It is non-concentrated contractions of the abdomen. Classically, crunches.
Classic crunches.
Classic crunches, classic sit-ups. Why? We make cuts on you to put the trocars in to do the surgery. That muscle has to heal. In a month or two, you look at it, you touch it and go, it's healed. It's not completely healed. The scar is going maturation, cross-linking, getting firmer. If you were to stress that area too much, there is the potential to develop a hernia, especially around the belly button, which is the bigger cut. When we're in the sleeve, we have to take the stomach out of there, so it tends to be a slightly bigger cut. If you're bigger as a person, it tends to be a bigger cut. So that's where we usually see the hernia, is right at the belly button. So we don't want a lot of stress, concentrated contraction right there. So we ask you, avoid crunches and sit-ups for about a year. Could you probably do it sooner? Probably. But this is, we want to avoid stressing that area and getting a hernia.
What if I think I'm going to lose too much weight after bariatric surgery and not look good?
Okay, so I have this conversation often with folks in the office when they're trying to choose the operation, etc. Two things. One is, looks are important. God knows I believe in it. But that's not why you're having bariatric surgery. You're having bariatric surgery for your health. So yes, looks are important, but it's secondary. So if you gotta lose 200 pounds and you only wanna lose 60 because you don't wanna look old, you're making a wrong decision. This is about your health. That we'll deal with the looks after, but it's about your health. Second, the likelihood of somebody getting too skinny after bariatric surgery is really, really rare. And it only happens usually if there's something wrong. There's a stricture, there's an ulcer, there's a problem that needs to be corrected. Because losing too much weight with bariatric surgery, especially the two procedures that I do, is almost unheard of. Now with the duodenal switch, yes, you get such malabsorption that some people do get malnourished, which is why I don't do that procedure. But normally, you're not even gonna get to your ideal weight. You're gonna save 10, 20 pounds of your ideal weight, and the way to get to your ideal weight is diet, exercise, really dedication, and most of us don't have that. So don't think you're gonna get too skinny. You almost for sure are not. Now, if you lose all the weight and you don't exercise, yes, you're gonna look drawn, you're gonna look older, you're gonna look more wrinkly. If you exercise and you get your muscle development, you're gonna look better. So that's the most important component. Don't worry about being too skinny, but exercise. I tell people all the time, exercise because you're gonna be skinny, but you wanna look good.
So definitely exercise is a huge component, and I cannot stress it enough, both to the men and to the ladies. You need to build that muscle. That's what keeps you from getting that drawn, droopy look, is building muscle. So not just cardio, but weight training is very, very important. Not only weight training, your supplementation. So it's very important. We tell all of our patients to take their vitamins, but vitamins are extremely important. And your protein intake. I'm currently working with a nutritionist right now for a new form that we're developing for protein intake, because I know it's hard to do the calculation of how many grams do I need, how many grams in 4 ounces of chicken breast. So we're actually working on a new form. I'm working with one of the nutritionists right now, so that it's kind of like easy for you to pick, say, okay, if I have 4 ounces of chicken and I have 1 protein shake and I have 2 eggs, that gives me this amount of grams of protein. Because your protein intake is extremely important for looking good, your hair, your nails, your skin, and for building that muscle. So all of those components, that is why our program is comprehensive. Why?
And as always, as in everything in life, men have an advantage. Well, I shouldn't have said that. So we have testosterone. So we tend to lose muscle less than women. So actually, resistance training, weights is even more important in women, because your tendency to lose muscle mass is much greater because you don't have as much testosterone protecting your muscles as men do. So men is important because you want to look good, but women is really important, so you don't want that drawn, skinny look as you lose the weight.
So we'll go to this question because it goes right into what we were just talking about. What happens to the loose skin?
So And this is my classic line. The loose skin is between you and your mirror. At the end, when you're done losing weight, and that is when you've had the same weight 3 months in a row, you're done losing weight. You look in the mirror and you say, I'm happy, I'm okay with it. Or you say, I want to go see the plastic surgeon. I don't do the skin. I have plastic surgeons I work with that I refer to you. And I always tell patients, they go, will I need plastic surgery? They're like, no one needs plastic surgery. Will I want plastic surgery? You may, and you may want to remove the hanging skin, some of the areas. It also depends if you lost a lot of weight, 200 pounds, you very likely are going to want to get rid of the hanging skin. If you lost 50, 60 pounds and you did exercise, you probably don't need or are going to want plastic surgery. But loose skins between you and your mirror, and the plastic surgeon can help you with that.
And lots of variables go into it. So your age, obviously, our skin loses elasticity as we get older. And how many times you yo-yo dieted. So how many times you went up and down. Kind of like for women like a pregnancy, because pregnancy down, our skin stretches. Same thing with your weight.
Oh, wait. I just remember, this is my plug. So yeah, I have a little bit of hanging skin. But mostly what I have is kind of wrinkly skin with a little few stretch marks because this was me. Now, I've shown this before, and a lot of people just can't believe it. There are people who tell me that is not you, and that is absolutely me before I finally got control of my weight problem, of my obesity. And again, here I was close to a BMI of 32, very close to meeting criteria for surgery. And another day we can talk again all the different techniques I used to get under control. I've been under control probably for about 10 years, and now I'm probably the best under control I've ever been. But when you lose that much weight, yeah, you're gonna have a little bit of saggy skin, you're gonna have a little wrinkly skin. To me, it's the point that I don't want plastic surgery, but yeah, you're gonna have some skin issues when you lose that much weight.
Yeah. Okay, can I drink alcohol after surgery?
Well, typically we have a very, very strict rule. The only way you can drink alcohol if you bring me a bottle of exactly what you're gonna drink so I can try it to approve it. No, all kidding aside. 6 weeks after surgery, with both the sleeve and the gastric, you're allowed to drink alcohol within reason.
In moderation.
In moderation. Does alcohol irritate the pouch and the sleeve? Yes. But most of the time you can drink it. Now you start to get a burning pain, a knife when you drink alcohol, you gotta cut it out because it's gonna give you an ulcer. The same story for caffeine. 6 weeks after surgery, with moderation, you can have caffeine and you can have alcohol.
The only thing I would say pertaining to the alcohol is definitely stay away from the sweet drinks. We don't want you having pina coladas and strawberry daiquiris.
Mango daiquiris, my favorite.
Those have, just one drink has the calorie intake of a whole entire meal. And they're very sugary. So if you have the gastric bypass, it's going to give you dumping. And if you have the sleeve, it's going to make you gain weight. Same with beer. We ask you to try to find a light beer that you like.
Right.
Because just the amount of calories that cuts is incredible.
Right.
So, we don't want you drinking those calories away. So it's not that you can't have alcohol. And that's why we want you to have it in moderation. A, for your health. B, for the calories. And definitely stay away from the sweet stuff.
Last thing on alcohol, you will be a cheap date. Whether you're paying or someone's paying for you. Why? After bariatric surgery, alcohol gets absorbed much faster from your stomach, from your pouch. So the same amount of alcohol that before you were fine, you're going to be drunk. So when you first begin to drink after bariatric surgery, start slow, check it out, because one drink may be enough to give you that happy buzz and you want to stop, because it does tend to increase your alcohol blood level much faster. So legally you can get drunk much faster with much fewer drinks. So when you first begin to indulge in occasional alcohol after bariatric surgery, do it very gradually. Check out how much you're drinking, how it's making you feel, and never drink and drive.
Yes, definitely no drinking and driving. Also, many times we recommend if you're gonna have alcohol for the first time, do it at home. Start very small, have a sip of wine, a couple sips of wine, see how you feel, see how you tolerate it, because everyone is different. Okay. Ana Maria Fernandez, 2 years after surgery and has lost 95 pounds.
95 pounds is very good.
Yes. Okay, I think I'm in a plateau after surgery. I keep going up and down 5 pounds.
That's probably you're done. So I always tell patients, how do you know I'm done losing weight? They come in and go, it's a year, I'm going to stop losing weight. No. It's a year and a half, I'm going to stop losing weight. No. How do I know I'm going to stop losing weight from the surgery? When you have the same weight 3 months in a row. And the same weight could be up 3 pounds, down 3 pounds, up, but that's the same weight. You know, for this purpose, 180 is the same as 182 is the same as 185. If you between 180 and 185 for 3 months, that's your post-bariatric weight. How can you change that weight? The surgery is done. It's giving you what it's going to give you. Now, how do you get out of a permanent plateau like that? 2 ways. Calories, exercise. The calories in have to be decreased. This is the point where you start to calorie count, where you start to concentrate on proteins, decrease carbs, decrease fats because they have higher calorie content, and increase the amount of calories you are burning. Exercise, especially cardio.
So when you hit a plateau, it is extremely important. One of the things that the nutritionist will teach you, and that I'm a huge proponent of, is journaling, food journals. So there is no way for you to know what's keeping you from losing weight unless you know exactly what you're eating. You know exactly the types of food you're eating. You know exactly the calories related to those foods. So if you don't know how to do the calorie counts, there's a lot of apps that do them for you now. I personally use MyFitnessPal, and I know there's a bariatric pal I think that a nutritionist recommend. But you can always make an appointment with the nutritionist and bring in your food journal, and they'll go over it with you, and they'll actually show you what things to cut out and what things to do swaps for. So you can always make an appointment for them to like tweak your diet a little bit.
Remember, it's the calories, stupid. In and out, it's the calories.
Yes. Out's important and very important. Marcia says, Dr. Sosa, you look so handsome.
Thank you. So people ask me, do you do Botox? Do you do fillers? Do you do special things? Do you do treatments? Do you do PRP? Yes, all of them.
If we sell it here, he has tried it. I can guarantee you that. He's tried more stuff than I have. I'm a little bit of a chicken. There's a few of the things that they're like, you want to try this? I'm like, no, thank you. I think I'm good.
I mean, I guess you could Google it or you might know, but we should do one of these things one day. I want to know what everybody thinks my age is. If you don't look it up, just guess what my age is, and let's see if I'll be happy with your opinion or not.
And please stop telling him he looks handsome. His head is too big already. La manga, ¿se puede dañar?
No, la manga no se daña. La manga puede ser convertirla en inútil si comes demasiada harina refinada y carbohidratos. No es que dañes la manga, no es que la manga se ponga más grande, no es que la manga pare de funcionar, es que la persona que come mucho dulce, mucha harina refinada, acuérdense, pequeñas porciones de dulce y harina refinada tienen muchas calorías. So, no es que se dañó la manga, es eso. Si esa es la pregunta que me estás preguntando. Si la pregunta me estás preguntando es, ¿puede haber gastritis o úlceras en la manga? Sí. Si hacen cosas muy irresponsables, mucho alcohol, mucha cafeína, mucha aspirina, cigarros, nicotina, es horrible para el pouch y para la manga. En ese respecto se puede causar gastritis y una úlcera. So, en ese respecto sí se puede dañar.
Yes, we definitely recommend for your health, for everybody's health, no smoking, but especially after bariatric surgery.
Right, nicotine is the enemy of the stomach.
Yeah, nicotine, and just to remind everybody, since we have a good audience here, after bariatric surgery, no aspirin or aspirin products.
Exactly.
A lot of patients forget years after
the actual name is in English is non-steroidal anti-inflammatories. That's the entire aspirin family. So nothing related to, and if you're not sure, look up the medication. If it's an NSAID, non-steroidal anti-inflammatory, you cannot have it after bariatric surgery. It will, if you take it more than a couple of days, damage the pouch and the sleeve.
Mi cirugía es 4/11. ¿Algunos tips?
Sí, la mayoría de los pacientes dicen, me voy a operar, voy a comer lo que quiera desaforadamente. Yo no torturo a los pacientes, no los pongo en dieta líquida, no los pongo en proteína, pero sean prudentes. Si 2 o 3 semanas de cirugía suben 10 o 15 libras, la recuperación va a ser más dolorosa, le va a causar, no se va a mover tan bien. So, si puede perder un poquito de peso o mantenerse antes de cirugía, se va a sentir mejor, se va a recuperar. Si empieza a caminar antes de cirugía, se acostumbra a caminar un poquito más. La mayoría de las personas que se van a operar son bien sedentarias. So, trata de hacer el hábito las 2, 3, 4 semanas de cirugía. Camine, vaya al parque, trate de moverse un poquito más. Eso ayuda. Cosas obvias. Si fuma, pare de fumar. Si toma mucho alcohol, pare de tomar alcohol. Si toma algunas cosas over the counter, como cosas herbales, tés especiales, cosas así, pare de tomarlas.
After surgery, when can you start exercising?
So right after surgery, we want you walking. We don't want you on a machine where you might trip and hurt the fresh wounds. So people ask me all the time, I had surgery a week ago, can I go to the treadmill? Can I go to the gym? No. We want you to wait a month to go to the treadmill, to go to the gym, to go to a stepper or a walker and start doing your weights. So walking right away, exercise, formal exercise, 1 month.
So, en español.
Inmediatamente después de cirugía, mucho caminar, pero no queremos inmediatamente cirugía ponerse en una máquina, en una estera, en una caminadora. Para eso queremos que espere 1 mes. ¿Por qué? Si tropieza, se da un golpe, a 1 mes no pasa nada, ni le duele. Si se da un golpe a la semana, puede dañar la herida, puede sentirse mal. So, a la semana, hasta el mes, queremos mucho caminar. Después del mes, gimnasio, caminadora, bicicleta, pesas.
Maybe I shouldn't tell you a few of the guesses on your age that are coming in.
Tell me, what are the guesses?
50.
Wow!
45.
Whoa, give me that name. I'm gonna send you a check.
Oh my goodness. I think we have a few minutes left, but that's all the questions we have. So what tips do you have for us today, Dr. Sosa?
So last week I introduced this thing. It's one thing that I don't do that I should do with all my knowledge and training, and one tip that may sound weird, but it's a tip to maintain especially weight control. So what I should do that I don't do: cardio. It is very important to do cardio as part of your exercise routine. Why? Not only does it burn more calories typically than resistance training, but more importantly, cardio makes your cardiovascular system much more effective. Your heart gets stronger, your oxygen delivery gets better when you do cardio versus just weights. Weights are very important for strength, they're very important to develop musculature, which then burns more calories. But cardio is very important. I tell folks, typical guideline, if you're in the phase where you have to lose weight still rapidly, lot of cardio. You're gonna work out for an hour, 45 minutes cardio, 15 minutes resistance training. When you hit that final plateau to the same weight 3 months in a row, half and half cardio, half and half weights. If you start to look really thin, which some folks do, awesome. Minimize cardio, 10 or 15 minutes for your heart, maximize resistance training. But cardio is very important. I never do it. I hate cardio. I hate the bicycle. I hate the treadmill. I hate that jumping thing which she makes me do sometimes.
Jumping jacks?
Yeah, those things. The burpee things. Are you crazy? I can't even do those things. So I hate cardio. I know I should do it more than I should. I do less than 5 minutes cardio, 55 minutes weights. It's one of the things I shouldn't do. You should balance cardio and weights for a better, healthier heart, muscle development.
My current goal is 4 days of strength training and two days 30-minute cardio.
She does spinning. I can't handle it. I try. I can't.
I want a rower now. That's my need.
I might do the rower. I might do the rower. Tip that will sound bizarre, will sound crazy, and maybe I shouldn't repeat in public. I'm not gonna even tell you the name of what I drink. Diet sodas. So just changing from regular soda to a diet soda will make a huge difference in your caloric intake at the end of the year. People are gonna tell me it's better not to drink any soda. I agree. It's better not to drink any smoothies, any of that. I agree. It's better to drink water, mineral water. But some of us are going to drink soda. We're just going to. It is, we like it, whatever. Get used to diet soda. At first it tastes a little weird, a little different, But if you drink diet soda for a week, at the end of a week, you will love diet soda. And when you drink regular soda, it will be too sweet for your palate. You'll be like, ugh. It's an important habit. Why? At the end of the year, if you add the caloric difference between the two, it's huge. The amount of sugar you get with regular soda versus the amount of sugar you get with diet soda. There are studies that say, people who drink diet soda are more obese. Of course, that's why they're drinking the diet soda, because they're obese and they're like, I want to. So those studies, it's not that the diet soda is making you obese, it's that people who have a weight problem more choose diet soda. Skinny people more choose regular soda. But if you're dealing with caloric issues, in other words, you got to lose weight, you got to get rid of fat, changing from a regular soda to a diet soda will make a huge difference in you at the end of the year. Pounds of weight difference. Again, I'm a doctor, so soda is not good for you. You shouldn't drink it. But those of us are gonna drink it should drink diet 0-calorie sodas.
All right, tip of the day. There you go. So thank you all for joining us. We will be back again next week.
Next week, I'm gonna tell you my age.
Oh yeah.
Don't look it up. I'm gonna tell you my age.
Keep sending
or
me
look
the
it
guesses.
up. Keep sending the guesses later.
All right, guys. Have a great day.
Have a great day.
Bye.